Hey guys, welcome to Medifaction. Today, let's learn how to understand and prepare a prescription. Prescription is the written order of a registered medical practitioner for one or more medicines together with the direction to the pharmacist for their preparations and to the patient for their use. Parts of prescription. An ideal prescription should have a date, a superscription, an inscription, a subscription, a transcription, and the signature of the corresponding physician. So, initially, a prescription should contain the doctor's name and his qualification, the address of the clinic or residence of the doctor along with his contact number, the date, and also the patient's name, his age, sex, and address. Superscription. More commonly, R suffix X or RX is thought to be an abbreviation of a Latin word recipe. It means you take please, an order to the pharmacist or dispenser for preparing medicines. RX may be derived from the Egyptian Eye of Horus, symbol denoting health, or maybe a symbolic appeal by physicians to the god of Jupiter, who is the god of knowledge, learning, and healing for the prescription's success. So this is how a superscription or recipe looks like. Next is inscription. It is nothing but where the doctor advises the patients with the dosage form of the drug, the generic name of the drug, dose of the drug, how often it is taken, and how it is taken. So this is how an inscription looks like, where the doctor has mentioned the dosage form of the drug, the generic name of the drug, the dose of the drug, how often it is taken, and how it is taken. Next is subscription. Subscription provide direction to the pharmacist or dispenser. This is what a subscription looks like. And transcription. It is the direction to the patient, contains instruction about the amount of drug, time, and frequency of doses to be taken. And finally, we need a signature where the prescription should be compulsorily signed by the prescriber. Here is the signature. Now let's see some abbreviations and its meanings. So, as we have already mentioned, RX means take thou, and the corresponding full forms are given in these columns. AC means before food, PC means after food, BD means twice a day, TDS means 3 times a day, QDS means 4 times a day, STAT means immediately, SOS means if necessary, OD means every day, OM means every morning, ON means every night, PO means by mouth, and QS means a sufficient quantity. You can check the full forms from this column. Hope you have understood the video. Like, subscribe, and press the bell button for more videos. Thank you. Thanks for watching.